Stay Strong, Live Long Falls Prevention Education series has been created for informational purposes only. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this television production.
So welcome to our Stay Strong, Live Long Falls Prevention Education, brought to you by the VON and the Upper Grand Family Health Team and our community partners as well. Falls are the leading cause of injury-related death among seniors and the #1 contributor to loss of independent living. In fact, 1 in 3 seniors will have a fall every year, and falling once doubles our chance of falling again. So our hopes is with this Wightman Telecom production that we can change those stats, at least in Wellington County, by empowering the community with the tools and knowledge that they need to prevent future falls. So today I have with me lovely Jenna Baker, who is a registered kinesiologist from the Upper Grand Family Health Team, and also Rachel DeYoung from the VON, who is the registered kinesiologist for the VON. And today they are going to talk to us about how do we build balance, how do we improve our balance, and why balance is important in preventing falls, and also those benefits of exercise and how exercising can prevent you from falling. So thank you very much, girls, for joining us, and take it away.
All right, thank you, Kelly. I'm honored to be here to talk today about balance and exercise and hopes to prevent falls in the community. Naturally, as we age, our body goes through a number of changes. These changes happen whether or not we like them. In this section, we'll be talking about balance and those specific changes that happen with balance as we age, how those changes can lead to a fall, the benefits of exercise and what exercise can do for our body at a physiological level, as well as how to get up from a fall if a fall does occur. What is balance? Balance is an even distribution of weight, enabling someone or something to stay upright as well as steady. All right. We gain and maintain information from 3 balance systems in our body every day. Those 3 balance systems help us stay upright and steady throughout the entire day. The first system that we're going to talk about is our vision. Our vision helps us make visual references to our environment about what is upright, such as a building or windows, and if that building has changed or if our body has changed in relation to that building. Our eyes also give us a visual reference as to where our head and body is in space. If you look on the screen right now, we see a little boy reaching out for a cookie on the counter. Our body, our vision, will allow us to see how far away that cookie is and how far we have to reach to grab that cookie. Those eyes are so important for all of these things. Our eyes also give us detail about motion within our environment, whether or not we are moving or whether or not things around us are moving. We can stand at the side of the road and we can tell if a car is going fast or slow depending on our motion as well as that car's motion. If we're in a car, we can also tell how fast we're going approximately depending on the stationary objects we are passing on the road. Our eyes are so important for keeping us safe in our environment for all these reasons. When we step outside of our home, we are able to tell if the sidewalk is covered with ice or with snow just by that reflective shine from the sun on that ice. They also give us input as to whether or not we have to step down for a curb or step up for a curb for that depth. As we age, our vision changes. So there are certain things that we can do for our vision. As Dr. Cassie Reed talked about in the past, going to the optometrist on a yearly basis is very important to make sure that we know about those changes that are going on in our body. We can get corrective glasses, and sometimes maybe getting our cataracts removed will definitely help this vision impairment. Our next system that we're going to talk about is our somatosensory system, or sometimes referred to as our proprioception. We are constantly gaining input from the receptors in our skin, muscles, and joints in our body, all over our body. This allows us to do things like touch our hands above our head without even being able to see those hands. When those muscles or joints or tendons stretch, they're sending signals to our brain about where our body is in space. So this allows for a lot of movement and helps with our balance quite a bit. This system can also give us information about balance underneath our feet. Sometimes if we're walking on an unstable surface, such as the beach or pebbles or a gravelly road, our ankles might shift, or there might be a shift in balance. And what happens there is that those proprioceptive receptors in our body will give us information about what to do, what to correct in this stance. So maybe we might need to take a step out to the side, or maybe we just need to walk a little bit slower. All right. The input from these receptors in our feet will also give us information about what is under our feet. Before we even know it, before we walk onto a carpet from previously walking onto a tile, our eyes will tell us, right? Another way our eyes are used for balance. But as well as when we walk on that carpet, our body instantly knows. It detects the changes underneath our feet. This also gives us a change in our gait or our balance. So we're now going to possibly walk a little bit slower, walk a little bit faster, depending on the surface underneath of us. If we're walking on a rough or scratchy surface, we might want to get off that surface as soon as possible because it is painful to our feet. Something like stepping on a nail or a thumbtack, what's our natural reaction? Well, it's to pull away, right? We don't want to step on that surface again, and we definitely don't want to put any more body weight on that foot with a thumbtack or nail in it. This is another safety mechanism that our body does, and those are called reflexes. Very important to keep us safe in our environment as well as maintain balance. Our last system that we're going to talk about right now is our vestibular system. Our vestibular system is located in our inner ear. It is comprised of the semicircular canals as well as the cochlea. The cochlea is the hearing device, and the semicircular canals are very important for the balance portion of our ear. We have 3 semicircular canals, and those canals are all at a different position in our ear. So they all detect different positions of the head. For example, if we were to nod our head, chin down to our chest, or bring our ear down to our shoulder, or to turn our head side to side, our semicircular canals in our ears are going to detect all of those changes. Those semicircular canals can also detect changes of the entire body. So, for example, if we were to go on a carnival ride, our body can detect the changes of our movement in relation to our environment. So it can tell if we're upside down, it can tell if we're moving up and down or side to side. So very, very important for our balance was benign paroxysmal position vertigo. Basically what has happened there is that we have a confusion in the inner ear. Some calcium crystals sometimes, we're not positive, some people say flakes, have dislodged in the inner ear, and they're bouncing around in those semicircular canals. And it's actually confusing the body. All right, so for some people who experience this vertigo, they feel like the entire room is spinning and they never get any relief from this feeling. They feel nauseous, very, very uncomfortable. You cannot stand up, you cannot lay down. It's due to this condition called BPPV. There are lots of successful stories where people have gotten rid of this, and pretty much you just have to go see your you have to go see your physiotherapist. And they can help you out with that. Most cases, we can get rid of that. And so that's going to be very troublesome for your balance. You're not going to be able to stay upright as that balance system is very confused. So just to wrap up here, our body balance is controlled by those 3 systems. Our visual, our vestibular, and our proprioception. All right. There are some things that we can do for our vision and for our vestibular, but sometimes we're at a loss with some of those things. The one system that we have complete control of is that proprioceptive system. And the way we improve our balance is through doing balance exercises. Our body cannot improve our balance unless we are challenging it. So we need to challenge it with balance exercises. We don't need a gym to work out. We can do all of these exercises at home. You can do them at home with us today. We're going to show you how to do these. They're called exercises at the kitchen sink. All right. They're safe, they're free, you can do them with a friend, and you do not have to leave your home. So we're going to have Jenna come up and we're going to do some of those exercises to show you today. Hi Jenna.
Hello.
All right, so we're actually going to go over to the kitchen sink over here. Whenever you're exercising, you always want to do a warm-up. It's very, very important that you get the blood flowing to those muscles as to prevent injury. So we're just going to get Jenna to warm up her leg muscles here. She's been sitting. So we're going to get the blood flowing to those legs there. At any time, if you feel comfortable, you can take your hands off the sink. You can do whatever you like there. As long as you've got those hands nearby, you can always grab onto the sink. All right, Jenna, that seems pretty good. We're going to warm up our ankle joint. So we're going to bring that foot out in front of us there, and we're going to just circle that ankle joint. Good. And we just want to make sure that whenever we're standing on that one leg, we have a soft knee and it's not locked. All right, we're going to switch and go the other way there, Jenna. Great job. All right, we're going to test that balance out. We're going to tap our toes out in front, to the side, and behind us. All right, so you can make this simpler by bringing the foot in every single time, or you can make it a little bit more challenging by bringing that foot out and going a little bit slower or faster. Great job. All right, we're going to challenge those calf muscles. So we really want to work on our calf muscles and keep them strong, because all of our propulsion comes from our calf muscles, going upstairs, walking downstairs, and walking in general. So we're going to work on those calf muscles by bringing our heels up off the ground and lowering again. Good. You want to do this nice and slow and controlled so that we're actually challenging the muscles. We don't want to just plunk back down on the ground. Good job, Jenna. All right. All right, we're going to challenge our hip muscles here. Our hips are very important to keep strong. We need to make sure that those hip joints are stabilized. So we're going to strengthen those hip muscles there. Jenna's going to bring her leg out to the side, pushing with the heel and bringing it back nice and slow. Great job. So you want to aim to make that toe pointing forward, pushing with the heel, and always making sure that that other leg has a soft knee. So you can make this a little bit harder if you want by just hanging that leg out there a little bit longer. So we're going to hold that one, Jenna. Good. And bring it back. All right. Any kind of modifications here are going to make it a little bit more challenging. Next, we're going to work on the buttocks and the back of the leg. So Jenna's going to extend her heel back towards me, squeezing that buttocks muscle and bringing it back to the other foot. Very important to keep your buttocks strong so that we are able to walk around, sit down, stand up from a chair, get out of bed, sit down on the toilet. Great job there, Jenna. All right, we're going to bring our feet about hip width apart and we're going to work on our mini squat. So you want to make sure that when you are doing this mini squat, you're actually pushing your hips backwards as if you were to sit down on the toilet. So Jenna's going to bring our buttocks towards me, have a little pause there, and come back up. When you come back up from that squat, you really want to try and squeeze your buttocks together so we get that really good engaged contraction. We want to make sure that we're not letting those knees go over our toes when we go backwards. All right, Jenna can just face forward towards us so we can see that. Good, and squat backwards. Good. All right. One more thing at the sink here, we're going to have Jenna practice standing on one leg. So right here, we're really challenging those ankle muscles, those knee stabilizers, as well as those hip stabilizers. And to make this more difficult, she can take her hand or just one finger, whatever she wants off the sink. She might even decide to just have those hands hovering there. You can do all of this at home as often as you want. As often as you can, we're going to build that balance a lot more. Good job. All right. Making that a little bit harder, we can add some motion to it. We can, move those ankles. We can move those arms. That's going to help challenge the balance muscles in our legs a lot more. Good job. All right, the last and final exercise we're going to do today is our sit to stand. This is our most important functional exercise that we can do for our body, as it pretty much challenges every muscle from our waist down. So I suggest doing this with a chair with armrests, if you have one. If you can't, then we suggest a chair that is at a good height for you. So if you want to, you can use those armrests to sit back down. It's up to you as well. When you're first starting off, you might really want those. All of our weight's going to be in our heels when we're pushing off. All right, so we should almost be able to wiggle those toes as we stand and sit down, because all of our weight should be in our heels. So we can even challenge ourselves. We can take those hands off the chair. We can use our legs, or we can have those hands out in front of us. So Jenna can push off her legs. You want to make sure that you're keeping your core nice and straight. You're tucking in your belly button, as well as pushing those shoulders back. We want to have a nice straight back, and we want to make sure that we're not rounding it as we stand up. Thank you, Jenna. That was great. All right, so these exercises can be completed at home. It doesn't take long. You saw that, Jenna did about 5 repetitions of each exercise. You can build yourself up to 10, 15, 20, and it doesn't really take that long. All right, do these exercises once a day, and you'll find that your balance will really improve. We are going to move into the benefits of exercise, and Jenna is going to take the floor from here. Thank you.
So welcome back. I am Jenna Baker, the registered kinesiologist with the Upper Groin Family Health Team. I am going to be talking to you today about the benefits of exercise. So I have a lovely slideshow, so hopefully we'll kind of go back and forth to me in the slideshow. So as we age, as Rachel was generously enough to tell us, our bodies do change, as well with many speakers that we've had over the previous week. So we notice that our bones change as we age. We know that our muscles change, so as we do age, we start to lose some of that muscle mass called sarcopenia. So as though we don't like this to happen, we tend to kind of seize up. So it's important to keep moving, okay? And as you witnessed from me and Rachel, we did lots of balance exercises, so hopefully you guys can start implementing some of those in your own homes after you watch our show. So our muscles become stiff and very inflexible, especially when we don't move. And sometimes when we want to move them, we can't because we've seized up, because we haven't been doing a whole lot of movement. And as we know, in this day and age, we're a lot more sedentary. We have heard of that term, the sitting disease. So we need to get up, we need to get moving. So the very act of standing is good for our health. So specifically standing for 50 hours, which might seem like a lot, can actually prevent one fall. So if you think about it, even just an hour a day of standing will prevent a fall every 7 weeks. So pretty substantial, considering 1 out of 3 people will fall over the age of 65. So think of that. Also too, Canadian guidelines recommend that we get 150 minutes of some sort of moderate to vigorous activity. Now, moderate to vigorous can be different for all ages and all fitness levels, but ideally trying to get some sort of moderate to vigorous physical activity in. So 30 minutes a day is all we're asking, which isn't a whole lot when you look at our 24-hour day. All we're asking is for 30 minutes. You can break it up. You can do 5 here, 10 here, another 10 there, wherever you can fit it in with your busy schedules. All right, so let me just pop open all these bullet points. So I think most of us know nowadays that exercise is good for us. I feel like I'm a broken record up here constantly telling you this, but it is true. We take medications, and there is a place and a time to take medications, but sometimes when we start taking too many of them, we can start having interactions. And then that gets us into the hospital or into the emerge a lot more than what we would like. I think most of us in this room want to stay as independent as possible. So exercise is the best way to do that. There's really not any bad side effects like you would see from some medications. So specifically looking at these lists, it's going to improve your stamina. So you might not see it, but when you're doing exercises, things are changing inside your body, things in your muscles, things in your bones. So basically, it's making us a lot more efficient, almost like a robot. You're just going to be doing everything you possibly can, like that Energizer bunny. So you're improving stamina, you're able to carry oxygen through your body. So you're going to be able to now walk 30 minutes, whereas maybe before you were only able to walk for 5, okay? Helps regulate blood pressure. So if you have high blood pressure, exercising can actually help lower that. So again, things that are changing inside that you don't really see, like your vessels are getting not so much your vessels, but your heart is getting stronger, so you're able to pump that blood and that oxygenated blood in through all those extremities that need it to operate functionally. Strengthening muscles, so lifting weights, carrying heavy objects, carrying grandkids around or carrying your own kids around are going to help strengthen those muscles. So say you're getting ready for Christmas, which is just around the corner, I hate to admit it, but pulling out some of those heavy crock pots, being able to lift some of those heavier objects, like your nice china, having to reach up high and reach them down, those muscles make a huge difference, especially when they're strong. Improving your flexibility, so even just bending down to tie up your toes, to tie up your shoes, just bending over to pick up grandkids or even to pick up groceries, even to reach up for that high cabinet to grab that higher plate or that higher dish. It all makes a difference. Controls our weight, so helps us to maintain but also to help lose it. Improves our mental and emotional health. So by doing exercise, we can actually reduce some of those risks of getting dementia and Alzheimer's disease. Improves sleeping habits. So when you're doing your 30 minutes of activity, that moderate to vigorous, you're burning some of that energy stores that you had. So yeah, come 9:30, 10 o'clock, you're actually feeling a little bit more tired and you actually might have a more restful sleep because of it. And can reduce your dependency on those medications. So as I talked to you before, a lot of times we can get really bad interactions happening with some of these medications. So if we can exercise, we can sometimes start getting rid of some of these medications that were on our docket before. And then improves our circulation. So again, getting that blood flow going, it's getting better oxygen. Sometimes if you experience really cold hands or cold feet, sometimes that's because of poor circulation. So by exercising, we can improve that. So you can get better circulation, better blood flow to the brain, to the hands, to the heart, all of those functional organs that we need to work optimally to have a functional life. And of course, I'm sure I could probably take up the whole Wightman Telecom hour, 2 hours, just talking about the benefits of exercise, but those are just sort of a good solid list of just some of the ways exercise can help us. And looking even deeper into ways exercise can benefit us is looking at reducing the risks of heart disease, even cancer, even hypertension, which is also known as that high blood pressure, diabetes, any other diseases. And research keeps coming out that basically every disease you can think of, exercise benefits it in some way. So I don't know if you've heard a lot of research studies that certain medications can do that, but to know that exercise is that one medication that works for every possible thing you can think of, that's like a miracle pill. So why aren't we doing more of it? It can even help to improve your appearance and delay the signs of aging. Who wouldn't want that? I would love to keep my appearance. Also helps to prevent injury from a fall, increases your healing time, lessens the severity of that injury. So again, if you're strengthening those muscles, strengthening those bones, if you do happen to have a fall, you're going to be able to get away from that without any injury because you're that much stronger, and you might even prevent the fall entirely. You'll have better reflexes, you've been strengthening that vestibular, that proprioception, your vision, all of those things to help you be a little bit more reactive so you can prevent those falls from happening. And overall, I think we can all say it improves our quality of life. I think that's the end-all message, improves everything. So again, I ask you just 30 minutes a day, whether it's a few of those kitchen sink exercises, or it's going to the VON SMART program, or maybe it's even coming to some of our family health team programs. So if you're ever interested, check out the websites, call a friend, or call the actual facility to get a little bit more information on how you can get a little bit more physically active, whether it's at home or coming out into the community. And of course, the more we move, the better we are.
You need 30 minutes of exercise, you suggest, right there.
Yeah.
Can that be taken up all in walking? Or
It can, yeah, it's whatever you feel comfortable doing. I personally would like people to break it up with other things.
Sure.
But if walking is where you're comfortable at starting, be my guest, start with that. But one thing, if it's something you've never done before, trying to go out and do 30 minutes right off the get-go is probably not going to happen, or you will do it and feel miserable and curse my name later. So I'd rather you start with even even just starting with 5 minutes and then just seeing how your body responds to that either 2 hours later or the next day. And if you feel okay, then try to keep bumping that up by a minute each week. Or if you feel like you can push that a little bit more, then absolutely do that.
Okay.
Yeah, good question. Good. So our next little talk is going to be talking about how we do get up from a fall. So sometimes it is inevitable, even though we're doing our exercises, we're eating properly, we've taken notes on everything that you guys heard today through the VON Telecom production, but sometimes it is inevitable and we do have a fall. So Rachel and I are going to be little demonstrators on how to get up from a fall.
If you do have a fall, the first thing we want to do is actually determine whether we are safe to get up. All right, so how we determine that is actually, do we have any injuries? Touch yourself, feel yourself. The first thing you actually really want to do is just wait and pause, gain some composure after that fall, because a fall is a huge, terrifying event. All right, whether it's slow fall to the ground, it's still a terrifying event, and we want to make sure that we are okay. We've got some composure before we actually try and stand up from that fall. So we want to check our body over and we want to make sure that we're not injured. The next thing we want to do is we want to determine whether or not can we actually get up off the floor by ourselves. If we say yes, and if we're not injured, then we're going to attempt to get up off that floor. If we find that we are injured, or we know that we don't have the strength to get up off that floor because it is physically exhausting to fall, then we're going to go to our comfort plan. And our comfort plan is a plan of action when we can't get up off the floor by ourselves. All right, so if we just look at the screen here, we have a list of things that we're going to kind of keep an eye on and we're going to do before we actually attempt to get up off the floor. The first thing we actually want to do after that fall and we've realized that we can't get up is try and attract some attention. If we have a medical alert bracelet, we're going to use that medical alert bracelet or necklace and we're going to alert someone. If we don't have one of those, we're going to try and find a way to get some attention. One of the things that I like to encourage people to do is actually carry a whistle on them. All right, if you don't have the medical alert bracelet, having a whistle is a good way of alerting someone else that you are on the floor or you are in danger. All right, if you don't have that on you, you're going to try yell, scream. All right, get someone's attention somehow. If that doesn't work, bang on the wall, bang on the floor, drag yourself, shuffle yourself to the phone or to the front door, try and get some attention somehow. All right, once you have that attention, then that person obviously can go get some emergency services to help you off the floor and determine whether or not you need to go to the hospital. The next thing you're gonna do is you're actually gonna try and keep warm. Like I said, falling is a shock. So you're gonna grab whatever you can, blankets, sheets, coats, pants, tablecloths, placemats, whatever you can to keep yourself warm. You're gonna cover the lower half of your body, all right? So you're gonna try and cover your feet and your legs. Next thing we're gonna do is we're gonna just try and keep moving. Those injured areas, we're gonna try and keep them still. But if we have, if our legs are free and they're not injured, we want to try and move those toes, we want to move those feet and those legs to relieve those pressure areas as well as keeping the blood flowing. All right. Last thing, something that often does happen when we fall is our bladder lets go. We're going to get away from this wet area so that we're not getting cold. and then we're going to cover ourselves up with those blankets again and keep moving. All right, so that's our comfort plan. Attract attention, keep warm, keep moving, and move away from the damp areas, all right, while we're waiting for help. That first and foremost plan there is attract someone's attention so that we eventually do get off the floor though. So if we do find that we're able to get up off the floor, then we're gonna try and attempt to get up off the floor. So we're gonna have Jenna come over here. And I'm going to actually instruct her how to get up off the floor. So you're just going to lay right down on the floor there, Jenna. And Jenna has fallen and she's on her back. She can't get off the floor. Can you roll over by yourself like that, Jenna? Not really. It's kind of a struggle there. She does have to use a lot of strength to get up from that position. So what we're actually going to do is we're going to bring our weaker side. So Jenna probably has a stronger arm, and I'm going to guess that it's her right arm. So she's going to bring that left arm up above her head. The next thing she's going to do is she's going to bring those feet up close to her buttocks, as close as she can. All right, and this is just going to make it really easy for her to turn over. She's going to just let her knees drop to the side. All right, that automatically turns her body all by itself. From here, Jenna's going to use that strong arm and she's going to kind of pull her body over, push up, and walk those hands so she's in a seated position. All right, next thing we're going to do is we're going to try and get to a chair, a couch, something that's going to help us pull ourselves up off the floor. All right, something sturdy. You want to make sure that it's not a wobbly stool. So we're going to go towards this chair. And how do we get there? We're going to either crawl on our hands and knees. And oftentimes I get, well, Rachel, I have knee replacements. I can't crawl on my knees. It hurts too much. I can't do it. Jenna's going to scoot on her bum. So she's going to use her arms and legs to push herself. You can either go backwards or forwards. And she's going to turn herself towards that chair. All right. Next thing there is Jenna's going to use that strong arm to push herself up onto her knees. So she's going to lift herself onto her knees. And she's going to choose her strong leg, which is probably going to be her right leg. She's going to pull that leg forward, lean her body into the chair, and push that other leg into the floor. Grab the chair, have a seat, and she's going to rest. All right. Falling was a shock, right? She's tired, she's exhausted. I'm going to assume that for most of you, if you try and get up off the floor, it's not going to be that quick. Right? It might be a long ways that you have to crawl on the floor, and it might be a while before you actually gain that composure. So she's going to rest there. After Jenna's felt a little bit more comfortable, she's actually going to phone and call someone and tell them that she fell on the floor. It's so important that you don't keep your fall a secret. You should always tell a family member and then follow up with your doctor. Super important to follow up with your doctor to tell them that you had a fall. Keeping falls a secret is not a good thing because we need to know why you fell. Maybe it was that Jenna tripped over the cat. So probably a simple solution there. But maybe it was that Jenna blacked out. So we want to know the reason why Jenna fell so that we can get a solution so that she doesn't fall again. All right, folks. So always tell someone that you've had a fall. All right, we always want to report that and have that taken care of. So one of the things that we want to remember when we see someone fall, or if we've come to a situation where we found someone on the floor, is that we don't want to rip them up off the ground right away. We actually want to try and get that person to get up off the floor by themselves. So I found Jenna on the floor here, and I'm just going to approach her. And if there's, lots of spectators around, you might want to just kind of clear up the area as well. Sometimes that can be very overwhelming with, 10 people looking over you. So I'm just going to come crouch down here and say, Jenna, are you okay? Like, did you hurt yourself?
I think I'm okay.
So Jenna thinks she's okay. I want to try and get you to get up off the floor by yourself. I'm not going to help you. I don't want to injure your shoulder, or I just want to make sure that you're okay to get up off the floor by yourself first. So you always want to take that initiative first. You want to get the person to get up off the floor by themselves. You can injure someone by trying to pull them up off the floor with their arm. You know, you can pull their arm out of their socket. If their arm is damaged already, you can worsen that injury. So we always want to have the safety of the person in mind and get them to rise up off the floor by themselves. I also don't want to injure myself, right? I can hurt my back trying to pull someone up off the floor. And if Jenna is hurt, Jenna can't get up off the floor, I'm going to go and call 911. And I'm going to just get someone here as soon as possible to help them or get her off the floor rather than me trying to help her myself. I'm going to just stay here with Jenna when we are waiting for those emergency services. Keep her comfortable. Like that comfort plan said, keep her warm. Maybe get her to move her fingers and toes and just comfort her. Maybe put a pillow under her head if that is needed. All right?
I would add one thing.
Yeah, go ahead.
And that is take control.
Yeah.
Because there's going to be a lot of people around, so you take control. I'm looking after this.
So, yeah.
You got to take control.
Warren from our audience had a really good point, and he said, if you're the person there and you found that person, you take control. All right, there might be 10 people here trying to add their 2 cents and say, oh, well, you got to do this, get her up of the floor, put a pillow under her back. Well, I'm going to take control of the situation. I'm just going to get these people to back up, maybe even just leave. All right, I'm going to control this. I'm going to help Jenna. I've called 911, so I've got it under control. That's a very good point, Warren. Thank you for that. So thank you, Jenna. Great job. Thank you, folks, for listening at home. If you have any questions or you want to know a place where you can exercise, you can contact Kelly G. We'll have her information at the bottom of the screen. Or you can contact the Upper Grand Family Health Team. There are multiple exercise classes that are free in this area. So you can contact Kelly G or the Upper Grand Family Health team for that information. Thank you for listening today.
Doreen has a question.
Oh, yeah.
Do you need to have a doctor's referral for the SMART program?
Exercise program. Typically we say that if your doctor has said in the past that it's safe for you to exercise, then by all means you can sign off that form yourself and you can come exercise with us. But we do like you to check in with your doctor, or if your doctor has said in the past that it's okay for you to exercise, that's what we would prefer.
And is there an age?
Our exercise classes is 55 plus. So we also do an in-home program, and this is for people who can't get out of their home, and they do need some exercises in home to get them past that stage where they've received physiotherapy, but they're not quite ready for the exercise class yet, and they're not quite ready to do those exercises at home by themselves. So what we do is we actually send some kind of exercise instructor, whether it's me, myself, the kinesiologist for VON, into the home. We assess the client and see what their needs are, what kind of exercises they would benefit from, and we do a 6-week program with that client in their home, getting them ready either for an exercise class or doing the exercises at home by themselves. That does need a referral though, that exercise program at home. And typically that's by your doctor, physiotherapist, OT, something like that. Question was, Warren drives for VON, right? Warren drives for VON. He takes clients to doctor's appointments, things like that. So he's wondering, what does he do in a situation where someone falls? Typically, you don't have the training to help those people up off the floor, off the ground. So what your role there is to call medical services, right? You're not allowed to help them up. You don't know how to do that. You might hurt their arm. In that kind of situation, what you do is you make the client feel comfortable.
Sure.
You put a coat on them, you comfort them, you say, oh, it's gonna be fine, you're okay. Do what that client needs to make them feel comfortable. You're not trained to pull them up off the floor, so yes, in that situation, it's pretty much just call the emergency services and wait with them. Yeah. Thanks, good question.
Did that answer your question?
Yeah. Kind of? In a way?
I know what my responsibility, as most people do for the but these people are on their own and they're walking.
Yeah.
And down they go.
Yep.
Who or what sort of assistance do they get? Or can we identify that?
Yeah.
From the community, is that what you're saying?
Well,
or?
maybe in their home, in their...
And then you talk about the OT role.
So yeah, like maybe in that situation, you have noticed that this person maybe needs a little bit more care.
Yeah.
VON does have a new program, the Senior Support Worker Program, and what that person's job is to connect this client with whoever they need to be connecting with.
Sure.
Maybe that client needs someone to come into the home and assess their home and say, oh, you really need a walker.
Yeah.
You've surpassed the needs of a cane. So now it's time for you to use a walker. That OT is going to give them the services they need. There's even the CCAC that, yeah, you can refer them onto that.
For an occupational
Yeah, for an occupational therapist assessment. So they can, we just talked about, they can get a mobility assessment.
a
A balance assessment. So they want a balance assessment because that's when the OT is going to come into their house and they're
Sure.
going to give them the referral for a walker or whatnot. For, personal, if you see someone, your family or friend, I mean, you can always pass along that information. Does that answer it now?
Yeah,
kind of.
That's fine.
Yeah.
It's just that a lot of these people are extremely fragile.
Yes.
And if I take them, I always make sure that the girls at the office know that, hey, this lady is very, very fragile. She needs
A little bit of extra care.
extra care, from the driver's when she has to bring her walker because the cane is no good.
Yeah.
So now have two canes, which is fine.
And it's people like you who are helping, right? You're
Yeah.
really you're worried and you're making that extra effort for that
Oh, yeah.
that lady who's fragile, and not everyone might notice that, and that's
Yeah.
good that you're picking up on that and you're
Yeah. So I know
Presenting
that
that.
from my own experience. So I make sure it goes through. But the concern I have is these people are out walking or they're in their house and they go down, and a lot of them are so fragile.
But
They
they're-
just
they break
how do
bones,
they
right?
get to it's the exercise aspect of it is a little.
It's hard, right? Yeah. And that's why we do have that one-on-one program, right? Like to build them up to that exercise program. No one, like even when I first started doing this exercise class, teaching it, thought, oh, whoa, like I can't remember all these exercises first off, and then I have to teach an hour class. How am I going to get people to constantly move when it's all brand new to them? So it's definitely hard going into an hour class or a 30-minute, 45-minute class when you've never exercised before and you're this weak and fragile person. That's what the in-home program is definitely for, yeah.
So I think for you, Warren, being the volunteer, and you're obviously really close to these patients if you're driving them from appointments. So having a conversation with them, letting them know that you're concerned for them, for sure, and then letting them know of maybe some of our services. So at the family health team, we have occupational therapists. Like Rachel said, they'll go into your home, assess the environment, see what needs to be done to make them safe. There's myself, the health promoter, registered kinesiologist. I do home visits. I go into the home, get them set up on a home program, visit them on a weekly basis, or promote them to go to other community programs as well. We have the geriatrics nurse, so maybe there's more of a cognitive dysfunction that's happening there, so we could have that geriatric nurse come in and do an assessment with them just to see if that's sort of the main issue as to why they're having a fall. We even have dietitians. Maybe they're malnourished. Maybe they're not getting the nutrients they need to even make those bones strong and muscles strong. So maybe having that dietitian come in and do a little bit of counseling as well. So there's lots of avenues that we probably need to look at for a frail individual. It's not normally just one thing.
Sure.
And a lot of times they have a lot of metabolic disorders happening. So sometimes it takes a bit of a community to help that one individual. But it will start with you, Warren. Start that conversation with them. Say, I know of these services. Would you be interested in maybe speaking with one of them and kind of get the ball rolling there?
Our body cannot improve our balance unless we are challenging it. So we need to challenge it with balance exercises. We don't need a gym to work out. We can do all of these exercises at home. You can do them at home with us today. We're going to show you how to do these. They're called exercises at the kitchen sink. All right. They're safe, they're free. You can do them with a friend, and you do not have to leave your home. So we're going to have Jenna come up, and we're going to do some of those exercises to show you today. Hi, Jenna.
Hello.
All right, so we're actually going to go over to the kitchen sink over here. Whenever you're exercising, you always want to do a warm-up. It's very, very important that you get the blood flowing to those muscles as to prevent injury. So we're just going to get Jenna to warm up her leg muscles here. She's been sitting. So we're going to get the blood flowing to those legs there. At any time, if you feel comfortable, you can take your hands off the sink. You can do whatever you like there. As long as you've got those hands nearby, you can always grab onto the sink. All right, Jenna, that seems pretty good. We're going to warm up our ankle joint. So we're going to bring that foot out in front of us there, and we're going to just circle that ankle joint. Good. And we just want to make sure that whenever we're standing on that one leg, we have a soft knee and it's not locked. All right, we're going to switch and go the other way there, Jenna. Great job. All right, we're going to test that balance out. We're going to tap our toes out in front, to the side, and behind us. All right, so you can make this simpler by bringing the foot in every single time, or you can make it a little bit more challenging by bringing that foot out and going a little bit slower or faster. Great job. All right, we're going to challenge those calf muscles. So we really want to work on our calf muscles and keep them strong, because all of our propulsion comes from our calf muscles, going upstairs, walking downstairs, and walking in general. So we're going to work on those calf muscles by bringing our heels up off the ground and lowering again. Good. You want to do this nice and slow and controlled so that we're actually challenging the muscles. We don't want to just plunk back down on the ground. Good job, Jenna. All right. All right, we're going to challenge our hip muscles here. Our hips are very important to keep strong. We need to make sure that those hip joints are stabilized. So we're going to strengthen those hip muscles there. Jenna's going to bring her leg out to the side, pushing with the heel and bringing it back nice and slow. Great job. So you want to aim to make that toe pointing forward, pushing with the heel, and always making sure that that other leg has a soft knee. So you can make this a little bit harder if you want by just hanging that leg out there a little bit longer. So we're going to hold that one, Jenna. Good. And bring it back. All right. Any kind of modifications here are going to make it a little bit more challenging. Next, we're going to work on the buttocks and the back of the leg. So Jenna's going to extend her heel back towards me, squeezing that buttocks muscle and bringing it back to the other foot. Very important to keep your buttocks strong so that we are able to walk around, sit down, stand up from a chair, get out of bed, sit down on the toilet. Great job there, Jenna. All right, we're going to bring our feet about hip width apart, and we're going to work on our mini squat. So you want to make sure that when you are doing this mini squat, you're actually pushing your hips backwards as if you were to sit down on the toilet. So Jenna's going to bring our buttocks towards me, have a little pause there, and come back up. When you come back up from that squat, you really want to try and squeeze your buttocks together so we get that really good engaged contraction. We want to make sure that we're not letting those knees go over our toes when we go backwards. All right, Jenna can just face forward towards us so we can see that. Good, and squat backwards. Good. All right. One more thing at the sink here, we're going to have Jenna practice standing on one leg. So right here, we're really challenging those ankle muscles, those knee stabilizers, as well as those hip stabilizers. And to make this more difficult, she can take her hand or just one finger, whatever she wants off the sink. She might even decide to just have those hands hovering there. You can do all of this at home as often as you want. As often as you can, we're going to build that balance a lot more. Good job. All right. making that a little bit harder, we can add some motion to it. We can, you know, move those ankles. We can move those arms. That's going to help challenge the balance muscles in our legs a lot more. Good job. All right, the last and final exercise we're going to do today is our sit to stand. This is our most important functional exercise that we can do for our body, as it pretty much challenges every muscle from our waist down. So I suggest doing this with a chair with armrests. If you have one. If you can't, then we suggest a chair that is at a good height for you. So if you want to, you can use those armrests to sit back down. It's up to you as well. When you're first starting off, you might really want those. All of our weight's going to be in our heels when we're pushing off. All right, so we should almost be able to wiggle those toes as we stand and sit down, because all of our weight should be in our heels. So we can even challenge ourselves. We can take those hands off the chair. We can use our legs, or we can have those hands out in front of us. So Jenna can push off her legs. You want to make sure that you're keeping your core nice and straight. You're tucking in your belly button, as well as pushing those shoulders back. We want to have a nice straight back, and we want to make sure that we're not rounding it as we stand up. Thank you, Jenna. That was great. All right, so these exercises can be completed at home. It doesn't take long. You saw that, you know, Jenna did about 5 repetitions of each exercise. You can build yourself up to 10, 15, 20, and it doesn't really take that long. All right, do these exercises once a day, and you'll find that your balance will really improve.
So thank you, Rachel and Jenna. We hope you found this session both informative and helpful. If you require further information about this topic or about the health professionals that did present the topic today, please stay tuned for the end of the session, and their name and information will be listed for you. Our greatest glory is not in never falling, but in rising every time we fall. And it takes a community to prevent a fall. So thank you very much.
For more information about the free Smart Gentle Exercise programs in your area, check out the Vaughan Smart website at www.vonsmartexercise.com, or contact Smart Program Coordinator Kelly G by phone 519-323-2330, extension 4954, or by email at kelly.gee@von.ca.